In this section, we'll take a look at folk healing, and I'm going to give you some examples of traditional healers. I want to make sure that you follow along in your textbook, or ideally, you've already looked at this material. In addition to our textbook and this PowerPoint presentation, you're also going to find some links to videos online that are going to give us some visual examples of healers. And then after that, we'll analyze what's taking place, what type of healing, in fact, is occurring. Let's move to the next slide. Our shaman is the most basic type of healer. As pointed out, it means he who knows. However, that's a misnomer and most likely a product of Western influence. The shaman is responsible for engaging in rituals. That's usually where the healing takes place in a state called ecstasy. Now, they also are responsible for going into the spiritual realm. So they're often referred to as a spiritual mediator. And in that spirit realm, they'll battle evil forces or perhaps ask for assistance from helper spirits. Now, you don't just become a shaman and say, hey, that's what I want to do. Maybe in modern times people do. However, traditionally, this type of healer has been regarded as a wounded healer. In other words, they went through some sort of episode of illness during the course of their life. So, the initiatory ordeal, this is an episode of illness that an individual conquers, and after that, they are believed to have some power when it comes to health and healing. In addition to that initiatory ordeal, healing, generally speaking, takes place during a seance. Now, you might think that's Ouija board stuff. This is the term that's used to discuss this ritual that allows an individual to engage in that battling or discussion with spirits beyond this world. The other thing here about a seance is it's not an event that just involves the healer and the patient. In contrast, this is often a community event. The ecstatic trance, this refers to the beginning of the healing episode. It's a trance that eventually leads to a state of ecstasy. Now, this often involves hallucinogenic drugs. For example, Eduardo the Healer, the Wizard of the Four Winds, his choice of hallucinogenic drug was the San Pedro cactus. He didn't simply ingest that, so too did his patients, and that brought them to the state of ecstasy where healing could take place. Let's move to the next slide. In Africa, the traditional Zulu culture believes in an individual referred to as a Isangoma or a Sangoma. So this is a traditional African Zulu healer or shaman. Like I said, that's generally speaking a type of common term that we can apply to many different types of healers. They often use medicinal remedies, and those remedies that they construct are referred to as muti. That's probably going to be on the test. Now, the interesting thing about muti is it may involve herbal remedies, but quite often it also involves animal parts and draws upon something that we refer to as sympathetic or imitative magic. So the Zulu Nsangoma, here we see in the left-hand side of the screen, he's reading bones, stones, and shells. This is one of the basic diagnostic procedures that they engage in to determine what type of illness is impacting the individual. Now, in traditional culture, Zulu Nsangomas also recognize that there's certain things that they just can't deal with, and they'll recommend that an individual sees a biophysician instead of them. So bone throwing, this is, like I said, a basic diagnostic technique. It's really similar to, maybe a stethoscope, engaging in auscultation, listening to one's lungs. It gives them a basic understanding of what's going on, and then they begin to dig deeper into the individual's illness. So a lot of the cures, as pointed out, they'll include a variety of remedies or elements such as animal parts. It'll use magic. Now, I had referred to the idea of sympathetic magic. We're going to see a video that does discuss the Insangoma and the Muti and the idea of sympathetic magic. And this really involves the idea that like things produce like effects. So if you use, for example, in the video, it's going to talk about the bones of a baboon. Baboons are traditionally fast animals. So you might use the bones of a baboon to increase the speed or the strength of the patient. Let's move to the next slide. In Malaysia, one of the traditional healers is referred to as a bomo, and we see this healer here laying his hands on the patient. So this idea that an individual can lay on the hands and cause an individual to get better or deal with their health issues, this really is prevalent among a lot of cultures around the world. For example, even looking back at the idea of Jesus of Nazareth, he laid his hands and he gave that gift to his disciples. So that's really where the idea, at least in the Western Christian tradition, begins to emerge. And we see it everywhere. Even if we go to the Kung, for example, they believe that they can heal by boiling their num. They enter a state of kia, as pointed out in our textbook, but healing takes place through their hands. What do you think? Do you think that people can really heal individuals by laying the hands on a person? Or is there something else perhaps happening there? And I think this gives us an interesting opportunity or a unique opportunity just to step back and say, what type of healing is perhaps taking place here? Are we looking at an individual getting rid of, for example, cancer or tuberculosis? Or are they dealing with another element of health care? So I'm going to refer back to the World Health Organization. They say that health is physical, social, mental, and perhaps spiritual as well. So could this involve that type of healing? The other consideration is, to what extent is a placebo effect operating here as well? We'll explore a little bit about that, but I also want to point to Western traditions and give you another example of a healing tradition that ultimately emerges because of the idea, a spiritual idea connected to religion, and that the individual that founded this particular type of accepted medicine today got his knowledge from spirits in another world. What do you think? Does that exist? Absolutely. Dr. Palmer, the father of chiropractic medicine, he said he got his knowledge from spirits in another world, and he believed that the healer had a religious obligation. He was a spiritualist. In addition to this chiropractic approach, he believed that he was manipulating various points in the body, not just osteological points, points in our spine, but these areas that generated power and energy, perhaps similar to Reiki. Like I said, a nice opportunity to reflect on perhaps some of the healing and the history in the West as well. Let's move to the next slide. Now, psychic healing, or a psychic surgeon in the Philippines, this is another fascinating type of healing process. And what we're seeing here, the image, is a healer who is apparently cutting open an individual. We can see some blood trailing down. He's doing that not with a scalpel, but just by rubbing his finger along the abdomen of the individual. And what he's going to do is he's going to reach inside of the individual's abdomen and begin to pull out objects. For example, maybe a nut, hair, a stone, something to that effect, or what might appear to be a tumor. So in the Philippines, we have a type of surgeon that's referred to as a psychic surgeon, and they use their bare hands to perform surgery. They engage in this process where we have an incision, it's made, and disease lesions are excised. They're taken out. I'm going to give you a link here to a ritual, a ceremony going on in the Philippines. Now, anthropologists, as pointed out in our textbook, have studied this as well. And it's not that we just wanted to go out and disprove something, but we wanted to understand what was going on. So Singer, an anthropologist, records psychic surgery under high-speed film. And what he discovers is there's a lot of trickery of the hand going on. he's hiding little loads of blood. And if we were in class, I would do this for you. Usually it freaks out a few people. So I say, okay, here's perhaps a scary moment. And I reach into my arm and I just kind of push down right on the back of my elbow in that area. And I break a little load. What I mean by a load is some blood that usually I make, or else if I remember to get out during Halloween and buy some of that fake blood, I take a little bit of saran wrap and I loosely tie it up so I can break that and make it appear that my hand or my arm is bleeding. And then I'll put it into a little bowl. And as I put it into a bowl, I take something out of that bowl, again, sleight of hand, and it looks like I've reached back into my arm, and now I've taken something out and I put it into that bowl, and I might take something else out again. Now, like I said, this usually freaks students out. And what I do is I'm trying to illustrate that sleight of hand is part of this process, as Singer illustrates. There's no question about that. It's impossible to take one's finger and slide it along the abdomen or any other area of the skin and make an incision. That's just not possible. In addition to that, what Singer points out is a lot of people, in fact, do get better. They believe in this. Now, that again leads us to the idea of power of belief, something that's psychosomatic, that our brain, our minds can affect our bodies. And we need to talk a little bit about something called the placebo and the nocebo effect. Let's move to the next slide. Here we see Eduardo the Healer, the Wizard of the Four Winds. He's sitting at his mesa. Now, he's a Peruvian curandero, and one of the ways that he heals is by manipulating elemental forces. He thinks that that will impact a person's well-being. Now, the picture that we're seeing right now, he's in that state of ecstasy. He's gone through that ecstatic trance. He's ingested the San Pedro cactus. He's really high. And in this state, he's speaking with spirits and he's balancing, like I said, the elemental forces. What are the elemental forces? Well, good and evil, for example. And he's doing so on the basis of a discussion that he's had with the patient prior to both of them ingesting the San Pedro cactus. So what do you think? Does this at all involve any healing? Can people really heal by balancing forces? I think if we turn our attention to Western healer, for example, and say, is there similarity to any Western healers or Western healing traditions where they balance forces and that helps an individual get better? Think about it as we go to the next slide. Like I said, think about it. And if Sigmund Freud came to mind, his idea of the ego, the superego, and the id, and talking to an individual to figure out what their unconscious desires and drives are. Ultimately, Sigmund Freud, in psychoanalysis, he attempts to restore the balance between the id, the ego, and the superego in an individual. So I think, again, putting stuff into perspective, we tend to engage in this process that anthropologists call othering. We create an exotic other. We don't see the similarities between us and them, but rather we emphasize the differences. Unfortunately, some of the videos that we're looking at, National Geographic, they do have a tendency to make things a little more exotic and not draw parallels that allow us to see the relationship between us and another group of people. Either way, is it possible that a curandero could be considered the same type of healer as Sigmund Freud? Now, one of the things I'll tell you is Eduardo the Healer, he was an intelligent individual. He went through a very rough life, and he has that wounded type of healer characteristic. He uses the ecstatic trance. He goes into ecstasy. So all of those characteristics are there. He also knows that there's certain things he can deal with and certain things he can't. Misfortune, hexes, issues with love. Those are the things that he can deal with. If somebody has, for example, an awful case of diarrhea, he might have some advice, an opinion, but he's going to say, you should go to the hospital and get that dealt with. He also has a very strong understanding of Freudian psychology, psychoanalysis, Carl Jung, all of that stuff he figures into his type of modern curanderismo. So when we look at these healers, we have to ask, what are they dealing with? Eduardo is clearly dealing with psychosocial issues. That's the type of health he's dealing with. Now, the really interesting thing is when we look at the whole or the healthcare system in traditional cultures from a holistic perspective, we see their pharmacopoeia, it's 35 to 50% effective in dealing with physical issues. So they're addressing some of the physical health. In addition to that, they're regularly dealing with social health, they're dealing with psychological well-being, spiritual health, social solidarity. So from a health perspective, and while some people are saying they're not engaged in medicine, they are. They're utilizing a lot of the practices, aside from x-rays, for example, and pharmacological research. They're engaging in a lot of the approaches that social workers and psychologists use on a regular basis. Let's move to the next slide. I want to play a little game with you here. In 2002, there was an article written by Woodhead et al. Called "Behaviors and Rituals in the Operating Theater." Now, this gives us an opportunity to reflect on whether or not all of the practices that we engage in are supported through scientific evidence, or are they simply rituals? If you're interested in taking a look at some of this stuff, Van der Geest, an anthropologist, he also has an article called "Sacraments in the Hospital," and he discusses the type of magic and rituals that are used on an everyday basis to improve the health of individuals. And this stuff just really isn't scientifically supported. Let's move to the next slide. So in this article, each procedure, it's been placed into a category, three categories. Category one, which refers to evidence supported from a majority of acceptable studies. So green light here. This is usually what we want to see with any scientific procedure. Category two, this means that there's some evidence, but it's been based upon a single study or inconsistent findings. Now, that's really kind of a guesstimate. We're not entirely sure. We haven't been able to replicate the results. So we're not going to say it's true science. Might be pseudo-science. Category three says that there's limited scientific evidence to support that any of these procedures actually make a difference. Let's move to the next slide. So when individuals engage in surgery, there's a basic requirement. All staff inside the operating room must wear a mask over the mouth and nose to prevent wound infection. What do you think? Is there a lot of evidence for this? Some evidence for this working, or limited scientific evidence? Category 1, 2, or 3. I'll give you a second, write it down, and then we'll move to the next slide. So if you were thinking that there was a lot of evidence that wearing PPE over one's mouth and nose to prevent wound infection, there's a lot of scientific evidence for that. There isn't. Category 2, according to Woodhead et al., science is based upon limited studies or inconsistent findings, at least in the operating theater. Big difference during COVID, okay? Do not take this information and apply it to any COVID situations. Let's take a look at another practice inside of the operating theater. In fact, I've changed my mind, and before we move on, I'm going to talk a little bit about masks because it is pretty important that we do wear them, and we need to understand what is actually happening here. So most individuals were wearing the very first type of mask here, the homemade type of masks people are wearing, or the ones that they're buying at various stores, and they do have limited protection. They're great from protecting an individual from larger particles, and generally speaking, they're working to about 3 microns or 2. Sometimes you see these with a filter that comes with them. It's called a 2PM. That's 2.5 microns in size. So we have a various different types of particles and their sizes, and I'll show you that in a second. But if we think back, for example, to remember Leeuwenhoek, he's mentioned in our textbook. And he was the first individual to see bacteria or to observe bacteria. And he was able to do so because bacteria is in fact quite large. So he was able to see this through his compound microscope. In contrast, a virus, they are quite small. And if we're looking at the novel coronavirus, the SARS coronavirus, on average, it's about 0.2 microns in size. So if we're wearing a mask that's rated at 2.5 microns, it's not protecting an individual from that virus in particular types of situations. So large droplets, generally speaking, yeah, if somebody does sneeze and there's a large droplet expelled, it's going to provide some protection, especially depending upon the distance that you are from the individual. However, for that respiratory, that airborne material that's sent up into the air, if you're close enough, it just doesn't have that protective type of property. The other factor here is these masks that we're looking at, the very first category, and they go down to the bottom, they're not fluid resistant. So we do see some companies making fluid resistant ones. Now, the mask that they were looking at in the study, it was the surgical mask here. It's defined as a medical device, and it protects individuals, number one, the person that's wearing it, from catching any large particles that might be in the air. But it provides that physical barrier for external fluids like saliva or blood. So the practitioner, the surgeon, for example, if they happen to sneeze or there's some expelling of saliva, it's going to prevent that from hitting the patient. So that's working in certain situations. And here with that surgical mask, it's noted that we're looking at an efficiency of greater than or equal to about 95%. Now the best masks are the N95. We're not using those. A number of N95 surgical respirators, those ones provide the greatest amount of protection for an individual. So what's happening here, and I've drawn over here, I'm just going to erase this. If we take a look at various sizes, human hair, it's 50 to 70 microns, so it's not getting through a surgical mask, it's not getting through an N95 mask. As pointed out, that N95, that surgical mask over here, the N95 is 0.1 micron of size. Okay, so it's protecting to an efficiency of 95%. In contrast, that efficiency isn't there with the surgical mask. So a dust particle, both masks are going to be great at protecting individuals from dust particles and also bacteria. It's not moving through there. It's quite large if we look at those various bacterial sizes. However, the new coronavirus, and as pointed out, it's coming in at around, let's say on average, 0.12 UM. A lot of that can, in fact, and here it's identified with these little red virus or virons, they're able to penetrate that mask in certain situations. So that SARS virus, it's going to be able to get in to that mask. Now, because it is waterproof, it's going to protect against large droplets. To a fairly good degree. Nothing is 100%. But as for those respiratory droplets, so we got those large droplets, it's going to protect that. But the ones that are in the air that aren't held together with respiratory sputum, saliva, the stuff that's airborne, it's not working against that. And the thing to understand is a lot of viruses really do come in this size that we're looking at around 0.1 micron in size. So that's some of the considerations that people have taken into consideration when they're looking at the idea of a ritual. And it isn't to say that it's not effective. It's just the degree to which it is effective. And in this particular research that we're looking at, it has not been demonstrated that surgical masks are 95% effective. Over here, yes, absolutely, N95, that is a very effective mask. Over here, a couple of studies, not a whole lot of studies. Okay, so either way, it's important to wear masks because it does prevent some sort of a prophylactic or a barrier, right? And I think it's important to underscore that now, especially that we're in COVID. And what that does is it produces kind of a natural, I'm going to define it as here. I don't hear anybody talking about this on the radio, but it's kind of a natural vaccination. You know, the idea with a vaccination is you want to reduce hosts. And you do so by giving an individual and their immune system a little taste of the virus, an attenuated virus, something that's dead that they can fight off easily, and people won't contract the virus. And as you begin to reduce those hosts and you keep on reducing the amount of hosts, eventually you get to the state that we did in, for example, our textbook points out 1978/1979, we eradicated smallpox. And we did that through a very aggressive vaccination campaign. In contrast here, if we can reduce the hosts through a barrier, what's going to happen is that virus, that SARS-CoV-2 virus, it's not going to have any hosts. Okay, so it's not going to be able to infect new hosts because we have a barrier. And if you don't have any new hosts, that SARS virus, ultimately, it's going to, oh, we get a little spelling error there. I'm not going to redo this slide because of that. Eventually, it's going to die out, okay? Because it's not going to have anybody to infect. It needs to live in somebody. So really what we're trying to do by having a barrier is we're ultimately trying to reduce, getting low on space here, right on this side, we're trying to prevent or slow this disease from becoming endemic. And if you can't remember what endemic means, it means within a population. So for example, H1N1, it's within a population. It's always circulating. I can do this to illustrate. It's always circulating within a population. So there's, and as new individuals are born, there's always a fresh new host to infect. So we're constantly moving. That's my diagram for constantly moving and infecting individuals. And what we want to do is we want to break that cycle. We want that virus ultimately to have no hosts, and when it has no hosts or no one to infect, it's going to die out or it's going to move into another reservoir. Right, and that's what happened with H1N1. Back in the 1800s, it moved into pig populations and then re-emerged. Okay, now we can move to the next slide. So another procedure is a patient is asked to remove all personal clothing, including their shoes and underwear, to prevent wound infection. So what do you think? Is there a lot of evidence to support this as a valid type of behavior that prevents post-op infections? Is there some evidence or limited scientific evidence? I'll give you a second. Write down your choice, 1, 2, or 3. Well, yeah, limited scientific evidence. I don't know if you're surprised by that, but it's something that, really made sense to me prior to reading this article. But they say there just isn't any scientific evidence or limited scientific evidence to support removing all of your personal clothing, including your shoes and underwear, to prevent post-op wound infection. Let's move to the next slide. So, hand washing. Appropriate surgeon hand washing hygiene should include no less than 10-minute hand wash. What do you think? A lot of evidence to support this. Category 1. Evidence is based on a single study or inconsistent findings would be category 2. Or limited scientific evidence. Category 3. Write down your option, your choice, and we'll move to the next slide. Category 3. That's amazing. 2 minutes apparently is enough when you're dealing with a good hand wash. So the basic argument here is this is more ritualistic. It fits into this category where people are doing something extra in an attempt to account for the stuff that we just can't explain. I'll talk a little bit more about this after we're done this exercise. And in particular, I'm going to talk about magic and rituals and baseball, believe it or not. Let's move to the next slide. A surgeon should wear 2 pairs of gloves to protect herself or himself from pathogens. What do you think? A lot of evidence, category 1. Some evidence or inconsistent findings, category 2. Or category 3, limited scientific evidence. 2 gloves. Give you a second. Okay, let's move on. Interestingly, there is support, and this does make sense, especially when you have pricks. So if you're wearing gloves and you tend to have a prick in the outer glove, you're still protected. There's a barrier there between one's skin and the individual. So finally, we get a category 1. Let's move to the next slide. Every surface in the operating room must be completely sterile. Floor, ceiling, walls. What do you think? Category 1, category 2, or category 3? Let's move on. Category 3, limited scientific evidence. Let's move to the next slide. A patient should be shaved and shower with a chlorhexidine detergent prior to operation. So this is a sterilization procedure. What do you think? Is it highly effective in reducing post-op infections? Category 1, category 2, or category 3? Let's move to the next slide. Category 3, limited scientific evidence. So again, we need to reflect on what's taking place. Why are these extra procedures there even though the science isn't supporting it or there just hasn't been enough science? According to medical anthropologists, this is part of the rituals in modern day society. Let's move to the next slide. So after viewing that material, we certainly don't want to go around saying that medicine involves magic. That wouldn't be accurate. So let's start off. Medicine doesn't involve magic. However, some of the practices do rely upon similar processes and similar perspectives. Couple of examples. Uncertainty. This idea that there are certain things out there that we can't control, it often leads us to engage in ritualistic behavior. So the idea that uncertainty can be controlled through rituals is really a psychological response. And if we're engaging in rituals, this may in fact increase the confidence of an individual and allow them to perform better. In addition to that, the symbols that are used, and we're going to talk about something called the total drug effect, the placebo effect, and the nocebo effect. They can alter a patient's perspective through those meaningful symbols and thereby create a type of response, a psychosomatic response. In other words, the mind enacts or causes the body to act in a particular way. Let's move on to the next slide. Let's take a look at symbolism in modern medicine then, because this is intertwined with an idea of magic and rituals and all that stuff that's generally associated with traditional cultures. Oftentimes in traditional cultures, we refer to their healing as symbolic healing. And the element, unfortunately, of actual therapeutic approaches and efficacious practices and therapies are removed from that type of definition when we say their healing is symbolic. We need to understand that modern medicine, it does continue to rely upon symbolic healing. Let's look at a couple of examples and then we'll talk about them in greater depth. So, number one, we've taken a look at the role of rituals in medicine, and we've also seen the role of rituals in baseball, for example. The placebo is also intertwined with a number of different symbols. And what we're going to find is because people respond or have physiological responses to symbols, some of that stuff is incorporated into modern pharmaceuticals and even the general healing event as it takes place in modern medicine. This is called the total drug effect. Let's move to the next slide. Let's take a look at placebos and nocebos. A placebo and a nocebo really work in the same way. They work on the power of perception and that perception influencing physiology. A placebo then is a symbol of treatment. Perception causes the body to react in positive ways to the substance that's being administered. Now, generally speaking, placebos are used in drug trials. The research group, they get the medication that's being tested. In contrast to that group, we need a group that really serves as a way to measure whether or not that new medication actually makes a difference. So the control group, they get a placebo, or what's traditionally referred to as a sugar pill. It's inert, there's absolutely no pharmacological value to it, and sugar is a little bit of a misleading statement. If somebody pops something in their mouth, they said, that's sweet. Well, they're going to know immediately that that's not medication, because we know medication doesn't taste good. That's also a symbol. So a placebo, in the end, it allows for measurement. The question that we're ultimately asking is, does the new drug work better than nothing? Now, in some instances, you might have three different groups. You're going to have the research group, you're going to have the control group, and you're going to have a group that gets the standard treatment. So we're measuring it in three different ways. Is the standard treatment better than the placebo? And is the new treatment better than the standard treatment and the placebo? Let's move to the next slide. In a drug trial, then, we expect this type of positive response here. For example, the research group that got the new medication, 70% of patients report decreased pain. Now, that's good. we have to say, well, what's happening in the control group? Are they also saying 70% of people in and abouts, hey, I have no pain? Because if that's the case, there's a problem. Generally speaking, if we look at the control group and we see that the majority of patients are reporting pain, in contrast to the individuals that are getting that new drug, we're going to say it works. But it doesn't always work this way. In some situations, for example, ulcers and ulcer medication, both groups, the research group, they got the new medication, the control group got the placebo. And interestingly, while ulcers disappeared in both groups equally, which would lead us to believe that the new drug really isn't working, something else is happening there, because a sugar pill or a placebo shouldn't cause an ulcer to go away. The control group, not only did their ulcers go away, but they never came back. So in that situation, we're looking at something different that's taking place. And we can pose the question, what if the control group says they have no pain? Or if the control group sees less pain than the research group? Generally speaking, this illustrates that there's a problem with the medication, back to the drawing board, and this is a result of the placebo effect. It could also have to do with individual perceptions that those individuals have and the power of symbols for them. What do I mean? Let's move to the next slide. So our placebos and nocebos, definition if you didn't get it down, symbol of treatment, we want to say that oftentimes they can reduce the symptoms of numerous conditions. There's no question about this. This has been well documented, including Parkinson's disease, depression, anxiety, fatigue, ulcers, warts, and the list goes on and on. And in some situations, placebo surgeries have been practiced as well. And the condition that the individual is complaining about goes away. Well, it shouldn't. For example, if simply an incision was made and then the individual was sutured back up, well, what's taken place there? Other than a little bit of pain, looking down and seeing a symbol that something has taken place. Like I said, this is a very interesting area in science, and it does tell us that symbolic healing is part of modern medicine. Now, in contrast to a placebo, we also need to know, and especially when we start to come back to talk about, for example, witchcraft and hexes and stuff like that, the nocebo works in an opposite manner, but for the very same reason. So if you believe in the power of a drug and you get better, that's a positive response. If you believe that somebody really has given you a poison, and it could be just a placebo, quotation marks around it, and you get really sick, it's operated in the same way. Your belief has caused a physiological response, and in that situation, we're going to call it a nocebo, a negative response to a substance that is believed to cause harm. Like I said, very fascinating. With respect to placebos and nocebos, I'll also point out that people have engaged in studies, scientists have studied placebos, and they find that people respond to placebos in different ways. So two groups, they both get placebos, except one group gets a red placebo and the other group gets a white placebo. Now, what do you think is going to happen? Are we going to see a difference between these two groups of individuals? Actually, the individuals that get a placebo that's red, we see more side effects in that particular group, which tells us perception is having an impact upon physiology. Now, how's that? Well, let's think of what's associated with red. Danger, warning, stop. All of those symbols that come to mind when we think about red produce side effects such as diarrhea, rashes, vomiting, nausea. In contrast, white, purity, cleanliness, on and on and on. Okay, we'll leave it there. Let's move to the next slide. Now, here I think is where symbolic healing becomes really fascinating, because now it starts to fold in on modern medicine. So according to Cran, red, yellow, and orange are associated with a stimulant effect, while blue and green are related to a tranquilizing effect. That's just the symbolism that we attach to color and the physiological response that's produced. We shouldn't be surprised that pharmaceutical companies also draw upon this knowledge. For example, I don't know if you've been pregnant, if your partner's been pregnant, if you've known somebody who's been pregnant, you've seen some of the supplements that women sometimes take during pregnancy. For example, Materna. Any idea what color Materna is? It's pink. Viagra. What color is that? It's blue. What color is Tylenol? Red and white. Why aren't they all the same color? Let's move to the next slide and explore this a little bit further. The total drug effect is something that is a regular part of medicine, and it uses symbols or draws upon symbols to increase the efficacy of pharmaceuticals. We're not saying that pharmaceuticals don't have a chemical value to them, that they don't produce a physiological response on their own. That would be naive. That would be silly. They do. The thing is, as we begin to change the color, for example, or the size of medication, or the way that it's administered, it makes it more potent. And this has been well studied. So the total drug effect, we want to say that these are the attributes, aside from the pharmaceutical substances, that play a role in the efficacy or the effectivity of a drug. They include, number 1, color. Number 2, the shape of the drug. Number 3, the size of the drug. And number 4, there's a number of subsidiary symbols also associated with healing. For example, when you think of a doctor, I want you to imagine a doctor right now. I'm not going to show you an image. I want you to imagine an image. What's it look like? What do you see? So, subsidiary symbols refer to all of those other elements when you think of a doctor. For example, their clothing, what they might be wearing around their neck, their general appearance. Maybe they're male, maybe they're female. This is what we begin to construct. Are they wearing glasses when you were thinking of that individual? Now put them in context. Where does healing take place? Close your eyes and imagine a place where you are being healed. What does it look like? What do you see around you when you're in the doctor's office? Do you see books? Do you see comfortable chairs? Do you see files? And what's that waiting room, the second waiting room, look like where we're examined? Are there particular symbols in there? Do we see anatomical models of, for example, the knee? Do we see anatomical models of the foot? Now, what would happen, do you think, if we took away all of those symbols that you've just imagined and create an entirely different healer and healing room? Let's move to the next slide. When I asked you to imagine a doctor, is this what came to mind? Probably not. And the symbols, while we look at this individual, they might be very professional. I don't know, they could be a doctor, but the symbols aren't there. There's a number of elements missing. I think if we just start off perhaps with a thumbs up, that type of gleeful behavior generally we don't see when we're visiting our physician. In contrast to that, you might have looked at a doctor and have imagined glasses. That could be another symbol for you that indicates a professional individual. Also, if we look at the individual's clothing, it doesn't fit our model. This individual just doesn't have the symbols that convey the meaning of physician to us. So I think probably what came to mind was someone that looked like this. Now, when we look at these individuals, these 5 individuals, we might also begin to distinguish between them. So just as an exercise, looking at these individuals from left to right, which individuals are physicians? Are they all physicians? Or are some perhaps nurses? And would you rank those nurses as well? Let's move to the next slide. I also asked you to imagine what the examination room looked like. And it probably didn't look like this when you were imagining it. In contrast, I suspect it looked more like this. And I think if you go across Canada and you go across the United States and throughout Europe, for example, these examination rooms are going to look remarkably similar. And there are, in fact, a number of subsidiary symbols here that tell us that this is a place of healing, ranging from the examination bed to the posters that are on the wall, the degrees that the individual is displaying. It all provides us with the symbols that play a role in that healing event. Let's move to the next slide. The total drug effect, then, it involves those types of symbols that we imagined when we thought about a physician, when we thought of the examination room, and if we think of medication, we're also going to come up with various symbols. They certainly don't look like gummy bears. I think even if medication was inserted into a gummy bear for an adult, it's not going to have the same power that medication would if it was smaller, maybe if it was white and red or black and red, depending upon the illness being treated. So we have color, we have shape, we have size, we have subsidiary symbols. They're all part of this total drug effect. And what we need to remember is the imagination is operating here. And this is why we can say that symbolic healing is part of medicine. And this is really goes back to the debate, is medicine a science or is it an art? So we can say the imagination, it can produce physiological responses. And because we understand that, we do draw upon these symbols in producing pharmaceuticals. Let's leave it there. All right, make sure that you've gone back and you've taken a look at any of the material that you might not fully understand. Take a look at it in the textbook. If you haven't done all your readings, make sure you do that. That's essential. And make sure that you go online and cover the content and look at any videos that have been associated with this particular segment. Okay? Have a great day. Take care.